Artcure PW Diffusional Patch, non-invasive method in disc herniation treatment. Lower back pain and neck pain account for the most prevalent disease for humans, following upper respiratory tract infections. This pain can occur in any age group and in every profession. Majority of lower back pain and neck pain is caused by disc herniation. In example, hernia. There are 33 vertebrae in the adult spine. There's a structure between each vertebra bones that serves as a cushion, called discus intervertebralis. These vertebrae surround a gel-like center which is called nucleus pulposus. Nucleus pulposus is a gel-like structure that contains approximately 80% water. The solid structure with strong elasticity surrounding this cushion is called annulus fibrosus. It holds onto the vertebrae with its special fibers. Hernia, disc herniation, is a medical condition in which a tear in the solid structure outside the disc allows the soft gel-like portion to bulge out. If this bulging part compresses on the spinal nerves, emerging clinical case is called the disc herniation disease. If bulging out and compress occur in the neck area, it is called the cervical disc herniation. If it is in the lower back area, it is called spinal disc herniation. Artcure PW Diffusional Patch, the art of treatment. Artcure PW Diffusional Patch is an effective and safe treatment method due to its high clinical success provided in a short time and its low rate of side effects. It's an alternative to current treatment protocols. It's a new system that makes its effects so deep and naive as an art performance without harming. Artcure PW Diffusional Patch is applied transdermally. The gel released through the patch acts in the herniated zone. Its mechanism of action includes decreasing regional intradisc density in the herniated zone and shrinking the current size. Patch ingredient rich nucleus pulposus together with formed carrier oils Oleum limonis and Oleum rosmarini. It causes a substantial decrease in the volume and weight of herniated nucleus pulposus, which contains 80% water, by enabling the evacuation of water inside of it. Nucleus pulposus that lost weight and volume make less pressure on the nerve roots and the spinal cord itself. This results in clinical recovery. Patient's MRI is required to be able to apply Artcure PW Diffusional Patch. This requirement is necessary to give the correct medical intervention because not each lower back pain and neck pain are hernia-driven. The application method is very quick after the decision is made that lower back pain and neck pain are hernia-driven according to MR result. First of all, open the card box of Artcure PW Diffusional Patch. Remove the primary packaging, leaflet, and 2 pieces of gel from the box. Tear primary packaging and remove the patch, sterile gel diffuser, and 5 bands. Attach both gels by screwing them to the applicators on the patch. Pour the entire gel into the patch. Using the sterile diffuser, make sure that the gel is diffused thoroughly. Remove the applicators on the patch with the gel. Position the patch so as to cover the hernia disc entirely and to make sure that the porous section has contact with the skin. Make sure that the patch is aligned with the spine and positioned on the herniated area. Remove the protective paper on the hypoallergenic adhesive bands, which come in the card box, and place them to secure the patch. Use other bands to cover the patch, slightly overlapping them one on top of another. When applied to the neck, position the patch so as to have the contact with the skin 1 inch below the base of the neck. Using hypoallergenic adhesive bands, cover the entire patch. Artcure PW Diffusional Patch is a medical device that works with intradisc density change. It has mechanical effects. The system which provides the mechanical effect is formed oil molecules present within the content of Artcure PW Diffusional Patch. Disc is in a vascular tissue, so it does not fit with blood. It supplies its nourishment through diffusion. Surrounding wall of the gel-like interior section is controlled semi-permeable nature. Experimental studies on rabbits have shown that permeability of outer wall of the disc increases at sections whereby structural degradation or tear occurs, and it becomes possible for formed oil molecules inside the Artcure PW Diffusional Patch to penetrate. Again, experimental studies on rabbits have shown that formed oil molecules cannot penetrate into a healthy disc whose surrounding wall is not damaged and it's not herniated. Product safety have been proven in cytotoxicity, irritation, sensitization, and genotoxicity tests. Although it varies from one person to another person, gel content absorption is completed within the first 8-12 hours after the patch application. It is normal to see pain increase in patients during this period. Analgesic support can be taken in cases deemed necessary by the physician. After the 12th hour, liquid starts to discharge from the herniated zone because of the change in the density and osmotic pressure in herniated zone. And this period may continue until the end of the 24th hour. Although this period varies from one patient to another patient. During the entire period, for 24 hours, the patient should lie flat on back and make a bed rest in order to decrease the load on the disc. After 24 hours, the patch is removed from the body and the application is completed. A quick improvement is seen in the first 24 hours after the completion of Artcure PW Diffusional Patch. A quick improvement in patients' clinical findings is seen 24 hours after the patch is removed. Artcure PW Diffusional Patch shows impact with high success rate when applied to the right patient. Artcure PW Diffusional Patch has extremely low total treatment cost in comparison with other treatment methods. Artcure PW Diffusional Patch has a high economical advantage when DP's cost efficiency evaluation is done. The rate of reoccurrence of the disease is very low because anatomical integrity is not broken during Artcure PW Diffusional Patch application. Symptoms improved patients should continue to protect themselves against the impacts that may cause disc herniation in their daily activities. It is sufficient to use Artcure PW Diffusional Patch for once. The second dose may be needed for some patients. This application can be repeated in 1-2 week time with the recommendation of the physician. Artcure PW Diffusional Patch may cause rash on the application area of the patients with sensitive skin. This rash recovers in 3-4 days without any permanent trait. You can use your regular medicine together with Artcure PW Diffusional Patch application. No negative interaction is experienced. Artcure PW Diffusional Patch is a registered, non-invasive method with low side effect incidence that may result in a short time. Use was started 5 years ago. Around 100,000 patients in Turkey and in the world regained their health rapidly with Artcure PW Diffusional Patch. Artcure PW Diffusional Patch, non-invasive method in disc herniation treatment.